I actually come from a family of physicians. My father's a gastroenterologist, my mother's a pediatrician. So I was exposed to it early on, and I would go to my dad's office, I would volunteer in the hospital, and I saw how hard my parents worked and how much gratification they got from helping people. For the last 10 years, I was director of advanced endoscopy at New York Methodist Hospital in Brooklyn, and I started my own fellowship program there to educate young gastroenterologists in these techniques and these procedures. One of the things that we've been seeing a lot of, for example, is pancreatic cancer and pancreatic cystic lesions. And there's a lot of work going into it. I've been involved with research projects. An area of an interest for me is what's called endoscopic ultrasound. Endoscopic ultrasound allows us to see the pancreas and other structures in very, very fine detail, much more clearer than an MRI or a CAT scan. We have the ability to biopsy, and we have the ability to deliver therapy, especially to certain kinds of tumors. For a patient, when they get diagnosed with, let's say, a pancreatic cyst, for example, they're nervous because the first thing they think of is cancer, especially if there's a family member or a relative, which is often the case, that had some kind of pancreatic problem. And that's an area of expertise for me and for most therapeutic endoscopists. We work we do a lot of work on the pancreas, and most general gastroenterologists do not. So to be able to offer that to patients, to reassure them that this is something they don't have to worry about, because it's a multidisciplinary approach, right? And you really need a team that comes together to take care of these very complicated diseases. And patients also like to know that their cases are being discussed by experts and that there's a whole team that's coming together to manage their disease, and that kind of reassures them. I was really impressed with the vision that the hospital has. They're investing in the institution, they're investing in the physicians, in the staff, and the nursing. And I think there's a real opportunity to provide something that really hasn't been here, and to build something to offer the community. It's always better to deliver care where patients are. It's more convenient. And this institution clearly has shown a desire to become a tertiary care facility to service their community. And I'm excited to be a part of that from the ground up.